Hello everyone, I'm Dr. Akhila, consultant obstetrician and gynecologist at Ovum Hospitals, Bangalore. Today I'd like to talk to you about the first trimester or the first 3 months of pregnancy. Why is this period so important? Because this is a period when the baby's organs are being formed. So what are the things you should be doing in the first trimester? Number 1, visit your doctor as soon as your pregnancy is confirmed, which is usually by a urine pregnancy test which is done at home. Why do you need to visit the doctor so early? Like I mentioned, the first 3 months is when the baby's organs are being formed. So in case you have any medical conditions which you don't yet know about, or if you're already on some medication which may need to be changed, etc., it is very essential that these things are done. So make sure you're visiting your doctor where a proper history is taken, examination will be done, blood tests will be advised, when you have to do the scan, all of this will be advised. Number 2, make sure to start folic acid as early as possible. Folic acid is a vitamin which is essential, especially in the first 3 months, because it helps in the baby's proper brain development. Folic acid deficiency can cause serious defects such as neural tube defects in the baby. So make sure you're starting off with folic acid as early as possible. Number 3, most commonly asked questions is about the diet. First 3 months you're provoked to a lot of nausea, vomiting, heartburn, gastritis, etc. So make sure you're having healthy home cooked meals without too much of spices, oil, masala, etc. And also try to have small frequent meals rather than heavy meals. Number 4, make sure you're having adequate rest. Again, common complaint is that in the first 3 months, the feeling of tiredness, sometimes dizziness, wanting to sleep all the time, etc. It is very common because your body is still getting used to the hormonal changes of pregnancy. So make sure you're getting adequate rest, don't overexert yourself, get adequate sleep. Number 5, please know that there is no bleeding which can be considered normal in pregnancy. So if you have any kind of spotting, bleeding, stomach pain, etc., it is important to contact your doctor immediately. So now we've spoken about the things that you should be doing in your first trimester. Let us talk about some don'ts in the first trimester of pregnancy. First and foremost, please don't self-medicate. Most of the medicines are not allowed to be taken in, especially in the first trimester of pregnancy, even if it is just for a common cold, cough, or fever, or whatever it is. So, because they can cause birth defects in the baby. So make sure you're consulting your obstetrician before taking any medication. Number 2, smoking, alcohol, usage of recreational drugs is a complete no-no, can cause serious birth defects, so should be completely avoided. Number 3, we already spoke about the diet. Please remember to avoid outside food in pregnancy, especially in the first 3 months, because we don't know what ingredients are being used in the food which is prepared outside. And many a time it may lead to some stomach infections and may end up giving additional medications such as antibiotics, etc., which is best avoided in the first 3 months. Number 4, many of you may be using creams or face washes for some common skin conditions like acne. Many of them have certain compounds which are not allowed to be used in the first trimester, even just as a topical cream. So make sure you're consulting either your dermatologist or your obstetrician before using any of these. Lastly, don't worry too much about weight gain. Many of them who come to the OPD, especially the family members, are very concerned that the woman is not gaining weight in the first 3 months. First 3 months there are a lot of food aversions, heartburn, nausea, and they're not able to consume a lot of food. That is fine. We don't really expect you to gain weight in the first 3 months. Weight gain really starts after the 4th or 5th month. As long as you're not losing too much weight or not getting severely dehydrated, it is okay to consume whatever is possible and have small frequent. So I hope I have been able to give you a basic idea about the first trimester. For any further queries, please feel free to contact me at Ovum Hospitals. Thank you.